Greetings, welcome to the Diabetic Mogul podcast. On this podcast, we will offer standard and recommended practice of not only managing your diabetes goal, but how you can get involved in advocating for proper access to healthcare and bringing opportunities within the diabetes online community. It's Tino, a patient advocate and a certified diabetes educator.
I'm Hona, I'm a medical doctor. Together, we want to raise awareness, open a discussion about diabetes, share ideas, thoughts, different perspectives, and overall create a safe environment for everyone who needs to express his or her thoughts.
We'll be hosting a series of podcast episodes from people living with diabetes, caregivers, healthcare providers, researchers, and we encourage you to get involved, get engaged, and come up together to create the change that we need.
Hello everyone, it's the Diabetic Mogul podcast and we have Nasser here with us today. Nasser, could you introduce yourself?
Yeah, my name is Nasser. I'm from Bahrain. I'm a psychology teacher, a psychology graduate as well. I also research in diabetes self-management, spirituality and distress.
Great. Can you take us through your diabetes journey and also what you wish you knew back then?
I got diagnosed at the age of 2, so not necessarily much room for me to know back then. I don't know, it was a struggle for my parents, as they mentioned. The diabetes clinic for children was not yet developed, so they kind of struggled with they said I was struggling with so many bathroom trips, thirst, fatigue, but not much that I can recall.
Oh, so you don't remember life without diabetes. How's that for you?
Honestly, I can't even reimagine my life without being diabetic, and it's almost a norm for me. That it does not make it easier.
I know you're active in the diabetes advocacy field. What can you tell us about access to healthcare system and healthcare professionals, including psychologists, for people living with NCDs, including diabetes?
So first of all, access to healthcare here, as soon as you're diagnosed with diabetes, you get your glucometer, your test strips, the insulin pens, the hospitalization, all of that is provided by the ministry. When it comes to technology, we don't have much options here. So access to technology, we only have Medtronic, which is provided by the ministry. When it comes to mental health professionals, the service is not provided. So most one-to-ones are done and handled by the nurses, diabetes educators, but not psychologists. So we don't have, the service is not provided.
So if someone wants to seek diabetes educator or a psychologist, he has to pay?
No, diabetes educators, the nurses usually are diabetes educators, but psychologists, yes, you have to pay outside public hospitals.
Okay.
Unless you have a psychiatric diagnosis or a psychiatric issue, but not like suffering from generally low levels of motivation, high levels of stress. No. So something diagnosable, you can go to a psychiatrist within the public field, but not if you're suffering, let's say, high distress because of diabetes.
Great. You have studied and you are a mental health professional. You studied psychology. What made you make the decision, follow this path? How did you choose this career?
I started off studying nutrition. I wasn't studying psychology. But yeah, I think I had a passion for kind of understanding behavior since a very young age. I was very well involved in community service engagement and advocacy when it comes to diabetes. I think since a young age, I used to give some type of speeches for people living with type 1 diabetes and for their parents as well. Because my mom was a diabetic nurse, what used to happen is that I would kind of sit across from parents and they would say, wow, you're normal, you play sports and you go to school and X and Y and Z. We used to have that back and forth. Due to these interactions, I think I developed kind of an understanding of coping mechanisms and what coping mechanisms work for some people and what others don't. I was reading a lot kind of throughout high school and trying to understand all of that. And yeah, when I went to university, I took an elective in child psychology and it was just fascinating. Next day, I changed my major to psychology.
Okay, so you started from nutrition field and then you went to psychology.
Yeah.
So regarding mental health, there have been many changes lately. We talk about it more. We have representation, we have awareness. Do you think mental health is unstigmatized enough, or should we make more steps towards that direction?
I think it's a very general question. Maybe it's not my place to comment on something like that. But from personal experience and from my reading, when it comes to mental health and diabetes specifically, I think it's not necessarily stigmatization. It's just that people living with type 1 diabetes, healthcare providers, and the general community is not necessarily aware of the impact that diabetes distress can have on self-management behaviors and can have on blood sugar levels and HbA1c, and kind of the list goes on. And I don't think it's stigmatization, or just stigmatization at least. It's just that mental health professionals don't necessarily have training in trauma-informed practices. And there is a field that's been quite popular in the last 40 years, and it's called neuroimmunology. And it just focuses on the effect of stress on the immune system and on developing and sticking to medical regimens. The field highlights how distress, how psychological factors can impact one's not even management behaviors, but actual blood sugar levels. So, like throughout my research and my reading, I've noticed that the relationship between diabetes distress and HbA1c and self-management behavior is quite strong. But we don't seem to focus much on that, but instead we focus on technologies and how many times you visit your doctor and how many times you check your blood sugar level. And it just throws me off because I come from that background. And generally, I think I have a tendency to think about those factors given my experience and my education. But we don't seem to focus on that. And not that I know of, but mostly the focus in a lot of countries seems to be on technologies and access to healthcare, which obviously are very important factors. It's just that diabetes distress and psychological factors are almost neglected in the process.
It's true that we seem to focus on the medical part of diabetes, the clinical part, the results, the numbers, and we often forget how diabetes can impact mental health. How important do you find people with diabetes having access to mental health care professionals?
Look, I think it's a bit of a tricky question because when we talk about psychological factors, I don't think it's limited or the solution is just kind of provide the therapist or a mental health professional. I don't think that's the solution, at least from my own perspective. And I think it's obviously like a therapist or the mental health care professional is going to create awareness and insight to the patient regarding the stress and, how it can affect X, Y, and Z. But I think it has to happen a little bit more structurally. And maybe I'm being too optimistic here. Go with me for a second. What I think can be potentially the solution is something a little bit more structural. Structural change happens within communities. It happens within societies. So understanding, I think, the cultural and social aspect of individual living with type 1 diabetes and trying to provide that sense of family, that sense of safety, that sense of security can alleviate a lot of the distress. And today's research is showing that. It's showing even if individuals don't go to therapy, even if individuals don't have potentially good doctors, what keeps them going, they engage in self-management behaviors because they feel loved, they feel safe, and they feel secure. I think that can't be done just by, having one mental health professional. I think it has to be done within a community and, investigating what aspects of community can we have. So one of the projects that I'm currently working on is just creating a community, just sitting down with people for coffee and just talking about how it sucks to have diabetes and what can we do, and just venting and just talking to people who talk in the same wavelength, think on the same wavelength. I think potentially that can be more impactful based on what I think than having a mental health care professional. Not saying that this negates this, but I think in combination it would work beautifully.
That's an interesting perspective. You say communities, you mean peer-to-peer groups like diabetics sitting together and just having discussions?
Yeah.
Have you been to such groups or have you organized something like that?
I'm trying to. Time constraint has been a very good friend to me. But yeah, that's what I've been trying to do. And we have a small group right now. We're, I think, 6 to 8 people. We just sit down, we meet once a month to plan something bigger, but it seems to be lagging a bit. Yeah, we sit down and talk about things. For the longest time, I didn't have a sensor on CGM. What I think was the reason is it stresses me out to see my blood sugar all the time. So what I used to do is just stay away. So I didn't have my sensor on. I went to a diabetes camp organized for the kids, and I met a lot of the adult peers who live with type 1 diabetes as well. We started talking about things. Went back home, felt good. I felt safe, and I felt it's gonna be okay, And a lot of people share my concerns as well. And if it's not perfect, it's okay. And all of these realizations are realizations you get from being in that community. I went back home. I put on my CGM, and it's been 4 months now, and I've had it on for 4 months, and it's been amazing. And I think it's an achievement for me.
In a scenario-based formula, say that we have a type 1 who has an eating disorder. What would you suggest?
Type 1 diabetic with an eating disorder, seeking professional help is recommended in that case. Understanding the combination and how the eating disorder affects diabetes and vice versa, and how does that on a personal, social, cognitive, and emotional level, what type of impact is there? And it's that when we struggle, we just don't have the tools. Most of the time, the tools are built in within us. The strength is almost in everyone. Just that sometimes when we cope, we use a coping mechanism that's not effective, and that's why we struggle. I know it sounds reductionist. I'm not trying to make the issue small. I'm just saying that it's just about finding the right coping mechanisms, and it's obviously not easy, and just trying to simplify the case. Yani.
Thank you. What would be a wish of yours for the future of a mental health professional involved in the diabetes field? What would you wish for that?
Mainly what I've noticed is we lack sometimes cultural and social understanding. And in many cases, what we think is the case is that he's a diabetic, so he falls under that label and he should have or she should have the following issues. And it's a bit problematic because if we don't understand the culture or social background of the individual living with type 1 diabetes, the help we offer is almost ineffective. It might be even incompatible with their lifestyle and their social and cultural background. So you give them advice, right? And you say, you go home and do X. And X becomes explosive when you try to apply it to that social or cultural background. I think one, obviously, any therapist or mental health professional I would want to personally deal with has to have a strong cultural and social background for the individual living with type 1 diabetes to feel understood and to feel acknowledged. It's quite important. And staying away from be positive and everyone gets sad, general labels, and instead investigating the person-centered treatment. Second is, I think what's been very beneficial for me in my journey, which I'm still learning a lot of things, is understanding how diabetes has impacted my own cognitive patterns and my schemas and the way I think about things and the structures. And we get married to the numbers. After 4 months, you want to see an HbA1c, right? A report with how well you've been doing and how much your blood sugar is. We can become calculated in a sense, again, from my personal experience. So just understanding how does that affect my relationships? How does that affect my academic orientation? How does that affect my hobbies? And all of these things. Tailoring kind of a person center, sitting with the individual once and twice and 3 times and 4 times and 10 times and 20 times and trying to understand, so how does diabetes impact his or her schemas and cognitive patterns?
I will keep that sentence married to the numbers. What have you learned from being active in the diabetes field and working with people with diabetes so far? What have you learned from them or from your way of coping with them?
Honestly, in the past couple of years, I haven't been as active as I want to be. But I think as a kid, since I was, I think, 8 or 7, I was meeting a lot of individuals living with diabetes. And it's always fascinating for me how everyone deals with it differently and how it impacts them differently. And it just gives you or give me an idea that there is no one specific formula. And even for me, kind of try a couple of things and then they don't work. And then I changed my sleeping schedule and then it doesn't work. So it kind of allowed me to be a little bit more flexible with myself. It told me that there is a lot of work that needs to be done. This is what I think I got from my kind of engagements.
One final question is about diabetes online community. You are relatively active on Instagram. We connect there. We see other people with type 1 diabetes. How important is this online community to the creation of the sense of belonging, of sharing? How important do you find?
I love that. I think it's huge. Now we're talking about diabetes. Maybe it's a one-sided conversation here, but for the podcast, you're getting to know me because of social media and because I was seen out there or something. I think it's a lot of my peers who I follow on social media give me the same idea. There is awareness. It's just social media. I think sometimes it forces us to be very brief because people are just going to be bored and scroll down. So I think a lot can be lost in translation and simplicity. Taking it at face level can be a little bit problematic. And something else is social media with diabetes specifically has caused me a couple of times to almost kind of be burnt out, seeing how much people advocate and how much people do and how good their blood sugar is sometimes can be a little bit overwhelming. I'm not very big on social media use myself, but I think it can get to you sometimes. It's something I also mentioned in the IDF training that we just see a lot of people doing a lot of things when it comes to diabetes, and that just makes us feel that what am I doing? It's just that we don't understand people's circumstances, and that's what we see on social media. So I think it can be problematic, but positives are there as well.
I agree with that. We have to find the balance between toxic positivity and representation and the meaningful representation and messages that we need to pass towards awareness. So I would like to thank you very much for being with us. Hopefully we will meet in a congress or maybe in another session in the podcast.
I hope so. It was very easy talking to you. Thanks a lot for this. You asked really good questions.
Thank you very much.
Thanks a lot for your time.
It's our honor. I wish you all the best in your journey and in your project. That was it.
Thanks a lot.